Recently, we sat down with Dr. Richard Ulm. Rich Ulm is a chiropractor who specializes in treating and working with strength and power athletes. In this episode, we discuss some of Rich's background as a strength and power athlete, as well as some of the variables associated with injury in these athletic populations. I hope you enjoy my talk with Dr. Richard Ulm.
There's two major thoughts. There's more of a Bulgarian idea, which is like a max effort thing. So you're working up to max effort. The idea being we want to be lifting as heavy weight as possible to force the nervous system and the muscular system to, adapt. That's a strong stimulus.
More motor neuronal recruitment.
Yeah, for sure. And then you also have the repeated effort method, which instead of working up, so let's say you're going to do 6 sets of triples. Mm-hmm. Well, you can do 6 sets of triples where, all right, I'm going to work up to a max effort set of 3, or I could do one where I'm going to do 6 to 8 sets of triples, but I'm going to be doing it at, 95% of my 3-rep max as opposed to working up to 100. I would argue that that's almost equally as challenging, that 5th, 6th, 7th set. As you get progressive fatigue, the nervous system is going to have to work harder and harder and harder. The benefit of that is that the rate at which you start approaching bad technique is slower. So if you're just doing like 3 sets of triples working up to a max set, you better have your shit together and know what weight you're supposed to do, what you can handle, because you might go in there and the jumps are so big that by the time you actually hit that last set, boom, that second rep, you blow your back out. If you're going to do that same style, you're going to do the same squat movement, but now instead of doing it in 3 sets, you're doing repeated effort method over 6, you can really feel like, oh man, if I do 2 more of these, it might get ugly. Well, if you're only doing 2 or 3 sets, it gets ugly and you're like, oh shit, that got ugly.
Yeah.
And that's where you can get hurt. So now, I actually think that it's probably more effective for athletes that don't need the ability to express a max 1 rep. I think it's better to do repeated effort method than it is to go after the max effort method.
Yeah, and classically, that's kind of been described as Eastern European versus more of a Western ideology behind conditioning sets and rep schemes, right? And some people say that one's more for hypertrophy and one's more for strength, which now the literature is a little bit equivocal.
Depends how you load it. I mean, you could, you could, now if you're working up to, again, if you're working up to a heavy set of 10, that's hypertrophy. It's a max set of 10. So, either of them can be used for hypertrophy or for strength or for power, endurance, whatever you want.
So maybe if we're working for or creating set and rep schemes for team sport athletes where we know that strength training is going to be important for them as far as decreasing their risk of injury, we would probably use more of the second one that you described, right? I
mean, honestly, I would use it even with Olympic weightlifters and powerlifters.
Yeah, okay.
Again, I mean, if I said you're going to do 10 sets of doubles and all your sets are going to be over 90%, that'll fuck you up. That's not possible. I used to do 10 sets of triples at 80%, and it was really hard in the snatch to do that. So you can make it really hard. The advantage, though, the main advantage is that you're not going to put yourself under a bar that you're going to fail at. You don't really need to fail reps to be a good athlete unless your sport requires, expression of a max 1 rep. So that's Olympic weightlifting, maybe CrossFit, and powerlifting. The other ones, you just don't need to do it. So I don't think, and I was a thrower, so we needed to be really strong. I mean, I had dudes on my team that could clean 450 and guys that could squat over 700, but you don't need to do heavy 1 rep maxes in order to get that. I don't believe you do. I think you can get there with high intensity repeated effort methods.
10 sets of doubles, then straight to the ice bath after that, right?
Straight to the ice bath, that's right.
You could live the rest of the day, huh?
Yeah.
So team sport athletes probably don't need to do that super duper high volume. I mean, they're going to work up and they're going to make progress in those lifts, obviously.
I think you mean intensity. They don't need to do high intensity, but the volume will go up a little bit because you're replacing the intensity with more sets. So instead of doing 5 sets of triples, you might do 6 to 8 sets of triples. And that's a little bit easier because, again, they're able to kind of feel out each set, and the nervous system progressively fatigues as you go through the sets. And that's going to create a lot of difficulty in the later sets. Like if I'm doing 6 sets of triples at 85%, even though your max, your 5 rep max is going to float between 85 and 88%. 6 sets of triples at that weight's pretty hard, especially if you cut the rest down. So if I'm only giving you 2 minutes of rest, now I'm actually demanding a lot of muscular endurance a little bit, despite the fact that it's only 3 reps. You have to recover. And so you can make them very, very challenging. You can make it for hypertrophy. You can make it for speed and power. But really, the volume is going to be separate. The max effort method, its hallmark is the intensity. And you can do both. CrossFit tried that for a few years and it doesn't work. People just break. But usually the higher the intensity, the lower the volume. So you can still play around with that. And either strategy, you can still have changing volumes.
If we wanted to make a recipe for hurting somebody, max out both of those.
It would be, well, that's what CrossFit experimented with in the beginning.
Yeah.
I mean, and it's there's no swipe at CrossFit. They were trying to figure it out. But in the beginning, it was more and heavier.
It was an experimentation kind of phase, right?
For sure. Yeah, they're getting better at it. I mean, I think that there's a lot of good people outside of, I guess, within CrossFit community, training think tank. It's got some really, really good stuff. OPEX puts out some really, really good stuff, although they're sort of deviating away from competitive training, but there's some great programs out there.
I do have an interesting way to think about this in a question. So one thing that's important is kind of figuring out what not to do. So if you were to design a recipe to hurt somebody's back, either within this week or within a couple months of training, what would you put in that recipe?
Lots of bilateral hip hinging.
Lots of bilateral hip hinging?
Yeah, so to kind of swing this back around to the spine, the main problem with strength training is that almost all the movements, or most of the movements, are sagittal plane, and many of them are bilateral, meaning you're holding two hands on a kettlebell, you're holding a barbell. And what that does is it actually limits your options that your body has to move. So that's called degrees of freedom.
Does that limit your movement variability?
Yeah, it limits your movement variability, all kinds of stuff.
That was just a hot topic word for a while, wasn't it?
Oh, yeah. But so when you're doing that, you're doing bilateral hip hinging. So let's just take, CrossFit as an example, or Olympic weightlifting. They're doing cleans, snatches, RDLs, good morning, squats, and then variations of the Olympic lifts. So hang snatches and hang cleans and power snatches and power cleans. It's all bilateral hip hinging. So it's bilateral upper body and lower body. And so that means that there is a lot of load in the sagittal plane, because if the moment you took your hand off of the bar and you're holding now a kettlebell, even of equal weight, well, now you're exposing your body to forces in all 3 planes. We call it triplanar forces, even though it's a sagittal plane movement, but you're getting exposed to triplanar forces. That's healthy. Your body has more options to move. But if you're doing lots of bilateral hip hinging, basically all the movement that your body might be able to execute in the coronal plane, right, which is going to be sort of sliding side to side or lateral bending, and the transverse plane, which is kind of traditionally what people call rotation. That's going to then take all of those forces and drive them into the sagittal plane. So now you have hyper extension of the spine, hyper flexion of the thoracic spine, and all of those muscles in the sagittal plane, that posterior chain, the primary muscles of that extension, compression, stabilizing strategy, those guys become hyperactive because you're only exposing the spine to sagittal plane forces. And that right there is going to increase the axial compression on the spine. It's going to extend and sort of smash the back, into the facets there. That causes problems. And then they're stuck in that position, and then they can't actually flex. And we can get into some pretty geeky mechanics about how that actually hinders flexion in a way that produces massive amounts of intradiscal pressure.
And before we get into that, I loved a lot of the modifications that you bring to your courses. So getting out of the sagittal plane is almost like one of your catchphrases, I feel.
Yeah, I mean, it needs to happen more for sure.
Yes, and I totally agree. And one of your big modifications, especially for, let's say I go into the gym, squatting hurts. Squatting is tweaking my back right now. And one of your big modifications, I don't mean to like sell off some of your stuff, but that
Please,
front foot.
I'll allow it.
Yeah, that front foot elevated split squat.
Yeah,
so
like a step back lunge.
And you'll do this with a barbell.
Yeah, I actually think that it's better than the squats to make the squats better. So if somebody they think it's a compromise, or they think that it's inferior to the squat, but if people come to me all the time, hey, can you write me a squat program? Sure, and then I send them a lunge program.
Yeah,
and inevitably, the lunge, it doesn't fuck their back up as much. It increases their unilateral strength, which just converts into a better squat. They have better proprioception, better balance, better muscle synergy on side to side, and then it just results in a better squat in a way that does not come with nearly the same risk of injuries that squatting does. The difference is, though, you have to keep the barbell and the weight on the front foot. A lot of times when people are doing a step back lunge, they're told to get into like vertical shin in the front shin, vertical femur in the back. So vertical shin, vertical thigh. Well, that offloads the front leg. And now your leg's not in a position that's anything like a squat, and you can't move a lot of weight there. So with a step back lunge, right, you start with your feet together. Let's say you're doing a high bar and you step back with your foot, you're stepping back into a lunge, but you're kind of squatting down to that front leg. So at the bottom of the movement, the barbell should be over the heel and the knee should be over the toe. So it's very similar to a squat and allows you to use a muscle pattern or a muscle synergy that is reproducible in the squat. So that has reasonable crossover there. So I have a lot of athletes that are using that as an alternative. And a lot of times, like I have Olympic weightlifters that don't squat. Like they do their platform training where they're already squatting, squat snatch, squat cleans. And then they don't need to do more squats. So we just have them doing lunges. And you'd be surprised at how much weight you can actually move. So just to give you a general guideline, you should be able to move 70% of your max, whether it's a 3 rep or a 5 rep or whatever, 70% of your max with at least 70% with a step back lunge. And I actually want athletes north of 80%. So
wow, that's a significant amount of weight.
It's a lot of weight.
It's basically one leg.
Yeah. Now you're using the back leg. It's not like it's a floating squat, right? It's not like I'll do that. You know, you have skater squats where there's a pad that you're literally single leg squatting on, or you have pistol squats.
Yeah.
That's literally a one leg squat.
Very different.
You're using the back leg to drive the weight forward and keep it over the front foot. And then the front leg is doing the work of lifting the weight. But I guess it's not exactly a one-legged squat. But when you do that, if you think about it, everyone says like, oh, you shouldn't do, like lunges aren't as good because you're not putting as much tension in the tissue. Okay, well, let's just do a little simple math. If you've got a 500-pound back squat, and let's say that you happen to squat perfectly evenly, that's 250 pounds of force going through both legs. Well, if you do a lunge, and let's say that you've got a really, really good percentage, now you can move 80%. Well, 80% of 500 is 400 pounds. So it wouldn't exactly be 400 pounds, but you're well north of 250 pounds going through that front leg. So even physiologically, the stimulus to create hypertrophy is even more than it would be in the squat.
Have you ever messed around with that with like force plates or anything like that?
Not enough to like study it. It's just a matter of not having access to them.
Yeah.
So I've done them.
That'd be a cool research.
It'd be a cool research thing. Yeah. I've done them I had a couple years ago, we had no squat November instead of Squattober. We had no squat November. And I think it was 3 or 4 CrossFit gyms and an Olympic weightlifting gym. They really just did plug and play. They just replaced their squats with a lunge. That was it. There was nothing, whatever they were programming, I didn't say, okay, here's your lunge program. I just said, okay, if you were going to do 10s, you're doing 10s each leg. If you're doing front squat, you're doing front rack. If you're doing back squat, you're doing back rack. There was no program.
And then what happened?
All of them came back and said that they had more PRs than they've ever had in a squat. And then the other one is that people didn't complain about their backs as much. And then the other interesting one is everyone said that it required less warm-up time.
Wow. I mean, that's pretty powerful. And if we get out of the low back for just 2 seconds and we think about the team sport athletes that we mentioned earlier, where modifications might be really good and getting into that kind of risky territory in, things like the squat and deadlift, if we change it up to the split squat, like you're talking about, if I mess up the nomenclature here, please correct me.
That's no big deal.
Yeah. And
so far you're nailing it.
So if we go into that split squat, we think about these jumping, cutting athletes, the ones at higher risk for things like ACL injuries, etc. Would we say that this is probably more sport specific for them anyways?
Yeah, you don't even have to get into ACL stuff. It's just the practicality of they're spending more time on one foot. So why train bilaterally?
Yeah.
It doesn't, why would you do that? So, and again, I'm not saying that one should never squat. I think squatting's great. What I would do to get into like the prevention stuff, maybe I would, if I were to just go back and just become a strength coach again full time, my primary lower body movement would be a front foot elevated step back lunge, or just a normal step back lunge. The reason you would need it to be front foot elevated is a simple reason, is that you're not exposing the hip to full flexion.
Yeah.
So if you're in a sport where you need to be able to sort of express that, Olympic weightlifting being the big one, then you damn well better expose them to that in training. But if you're a basketball player or a soccer player, you could get away with just doing it straight off the ground. They're barely breaking parallel. That's fine. It doesn't need to go all the way down. Yeah. I am a full range of motion guy. I think it's good to do that. But I would use that as my primary movement, and then I would actually move the squat into a secondary or even tertiary movement. And in the squats, I would be favoring front squats over back squats as well.
Coming from the running world, I'm pretty sure my hip flexion didn't break 90 degrees for like 10 years of my life.
No. Probably didn't break 70. So that would that squat or that lunge, I think would be, if I say this all the time, if I had done all lunges for my squats and all my squat sets were all my lunges were squat sets, I probably would have 0 back injuries.
But then you wouldn't be here, right?
I wouldn't be here. I wouldn't have learned about the stuff. It's definitely a two-edged sword, but most of the stuff that I figured out, which we can get into if you want, it came from having the symptoms. I don't think I could just watch a patient and figure this out. The main one, the role that axial compression plays in the pathological process was one I could feel. But the biggest one that we haven't talked about yet, that I sort of alluded to earlier, is how when you have a hyperactive posterior chain, it actually blocks flexion. And that's a little bit hard to understand. So if you think about it, if you're,
and by flexion, we're talking about
bending forward like you're going to touch your toes,
extension, bending backwards, and people are getting locked into that backward, almost like a tonic backward bend all the time. And then they can't access full range of motion. So now let's dive into that.
So just being locked in there and the axial compression increases the pressure within the disc. And that's going to increase the likelihood that you're compromising the annular fibers, which are those like stiff rubber bands wrapped around the fluid-like substance in the disc called the nucleus pulposus. If you just smash the disc with massive amounts of compression, you're increasing the chronic tension in those fibers, and that breaks them down faster. It actually blocks imbibition, which is the way that they get nutrients. And so then that would basically give them a nutrient deficiency over time, leading to tissue degradation and early onset degenerative disc disease. So that's one mechanism. You also, though, have another one, a complete other one, where you've got they block flexion. So when people have low back pain, because the mechanism of injury is oftentimes flexion, people try to not flex their spine. So there's famous researchers.
Fear avoidance behavior. Yeah, good. Yeah.
But there's famous people out there that are just like, well, just don't flex your spine, which is fucking ridiculous, because we have evolved to flex our spine. So if you're going to touch bend down to like pick up a pencil, or you dropped your phone, or you got to tie your shoes, flex your fucking spine. But the problem is the way you flex matters. And I just want to cover, there's a bunch of strategies, but the two main ones, one of them is going to be with pressure in the belly. The other one is going to be with excessive spinal extension, spinal extensor activity. Those are two sort of like opposite strategies. One of them is a healthy way to flex the spine. The other one is a really unhealthy way. So when we have, let's go over the healthy way first. You have pressure on the belly. And remember, intra-abdominal pressure is an outward pushing force inside the abdomen created by the diaphragm. Remember, that's half true.
So that's when I put my hands on my stomach, I take a breath in, my hands expand, and then I can pressurize on top of that. I can create my brace on top of that.
If you can feel the expansion, you are pressurizing.
Perfect.
Now, how much pressure you generate has to do with how strong is the contraction of the diaphragm, coupled with how strong is the resistance of the surrounding torsal muscles. Most people just feel it in the abdomen. Cool. So if you have sufficient intra-abdominal pressure, the pressure, it's a physical force pushing on the spine from the front, right? It's not this mystic force in the belly. You're literally jamming your organs against the spine, right? You're jamming the fluid, the solids, and the gases back against the spine, and they basically create these pillars or this buttressing that supports the spine. So when you bend forward, there's actually something pushing against it from the front, supporting it.
Yeah.
It'd be no different than like you look at a cathedral and you see some of the arches and they have these pillars in there holding it up. Or, if you go back and you look at like one of these bridges from the, back in the Roman times, you can see all these pillars supporting the structure across the top. Cool. Well, that means that you're able to flex forward and the back is able to round over. It's able to achieve flexion. Great. Well, in that case, yeah, there is a rise in intradiscal pressure, but it's minimal. Where it becomes a problem is when you have a spinal extensor group, your posterior chain, that is incapable of elongating. So if you're stuck, you used to use the word tonic, which is good, but if you're stuck in a rigid concentric contraction, you're unable to lengthen your muscles under contraction. So what that does is that blocks separation of the posterior part of the joint. And what ends up happening, like when you flex forward again, let's go back to the healthy spine. You flex forward again, the anterior parts of the joint, the bones, so you got a bone on the top, the bone on the bottom, they're going to approximate, get closer together. And the posterior part of the joint, the SPs will say, they separate. That's in healthy flexion, right? Yeah. So you have pressure in the front supporting it, and you have the spinal extensors allowing that opening up, that separation to occur. When you're using an extension compression stabilizing strategy, that separation doesn't happen. So now the back part of the spine, instead of separating, becomes a fulcrum. And that fulcrum then turns that joint into a class 2 lever or a nutcracker. And the nut in this analogy is the disc. So when you bend forward, you have approximation of the anterior part of the joint without separation of the back, the posterior, and that creates a massive spike in intradiscal pressure, which is why people herniate their discs bending over to pick up their protein shaker or trying to put their dog's leash on. These really innocuous, tiny movements. It's not that flexion is bad. It's not that they were holding massive weight. It's the strategy they were using massively increased the internal forces acting on the spine, and that's what created the failure in the tissue of the disc.
That straw that broke the camel's back, if you will. And oftentimes, we'll see people that it's more like, I was warming up and I felt my back go out.
Right.
Oftentimes people are set and ready to go. They're using all that spinal stiffness. They're using their weight belt, et cetera, when they're doing their maximal lifts. So would you say that you often will see people warming up using maybe 10, 20, 30% of their 1 rep max and then injuring their back, and potentially this could be an etiology behind that?
Yeah, it's also more often after. So you kind of train the low back or train the posterior chain, you crank on your spinal extensors, and then they do something like, grab their training book or, bend down to grab their shoe, and then that's when their back goes out. Again, it's not the external load, it's the internal forces. And a lot of times you get these arguments where, you shouldn't flex your spine or you should. Well, no one talks about, how are you flexing your spine? Are you flexing it with hyperactivity of the spinal extensors, or are you flexing it with sufficient levels of intra-abdominal pressure that allows relaxation and elongation of those structures?
So I really love the part that you mentioned about the internal forces. And these are the forces that we create regardless of whatever external force. And one thing that DNS really highlights well is the fact that many of the high performers are operating at a very high level and not placing as much internal force while still accomplishing motor tasks in a very adroit manner. So they're doing stuff really well without generating too much craziness.
Yeah, I mean, the whole, I mean, this is an entire podcast that we could do. But really, if you just water it down, like, well, what are you trying to do? You're trying to minimize the internal forces acting on the body. And you can move in a way that creates more internal forces. You can move in a way that creates less. And the idea, is to move in a way that uses as little effort as possible. So when people are looking at movement, they're typically looking from the outside and they're drawing lines and going like, oh, here's the moment arm for gravity and yada, yada. Well, they're forgetting that it's a lever system, right? There's two sides to it. And there's also the muscles that themselves are creating, torque on the actual joints themselves and shear and all this other kinds of stuff.
A lever system governed by our own neurology, right?
Right. And so it's the internal forces. This is a line I got from Pavel Koach. The internal forces are more often than not the forces that cause the problem, not the external forces.
This program is for informational purposes only and is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician with any questions you may have regarding a medical condition. Always consult with your physician before starting any exercises or doing anything contained in this program. Always stop if you experience any pain, discomfort, or difficulties performing anything described in this program.